The views and opinions expressed in this podcast episode are solely those of the individuals participating and do not necessarily reflect the views or opinions of Riverbend Media Group or the Riverbend Awareness Project, its affiliates, or its employees. It is important to note that the discussion presented is for informational purposes only and should not be construed as medical advice. Listeners are encouraged to consult with qualified healthcare professionals for any medical concerns or decisions. The Riverbend Awareness Project is a product of Riverbend Media Group.
Today's episode is sponsored by Mountain View Hospital.
Welcome to the Riverbend Awareness Project. This is Emma.
And this is Melissa. Each month we talk about important issues that affect the nation and also our community. And today we're talking about breast cancer awareness. And we have three awesome guests with us today. We have Britnee from Mountain View Hospital. And we have Cassie and Tamira from the Teton Cancer Institute. Could you guys just give a little brief introduction of yourselves and what you do at those places?
Yes, as you said, I'm Britnee, and I am a mammotechnologist at Mountain View Hospital. So I'm the one doing the mammograms and working with the patients during that process.
Hi, I'm Cassie. I work at Teton Cancer Institute as an infusion nurse. I am also a breast cancer survivor and have gone through this whole process myself.
And I'm Tamira at Teton Cancer Institute. I am a nurse navigator now, but I was an infusion nurse, so I have helped many women through this trial of their life. So we just are able to speak on it a little bit.
Thank you all so much for coming in today. Our first question is, how did Breast Cancer Awareness Month start?
So Breast Cancer Awareness Month actually began in October of 1985. It was through a partnership between American Cancer Society and Pharmaceutical Division of Imperial Chemical Industries. It was originally created as a way to encourage women to get regular mammograms, but has since expanded to address treatments, research, and funding to just better support women and also men.
You kind of already answered the question, what are the goals of Breast Cancer Awareness Month? But what are the goals, in your opinion, for Breast Cancer Awareness Month?
So one aspect of awareness is obviously public education. Breast Cancer Awareness Month campaigns help teach the signs and symptoms of breast cancer and ways of prevention, including how to perform self-exams, how to access proper screening, and the importance of regular mammograms. Another goal of breast cancer awareness is fundraising for research through races, walks, social media campaigns, and other events throughout the month. Researchers gain more funding to continue to develop new therapies and targeted treatments that have improved outcomes for our patients and help drive their mortality rate down over the years and give hope to patients facing the disease. But most importantly, Breast Cancer Awareness Month is a time to show support and a time to celebrate and honor all of the individuals affected by breast cancer, including those diagnosed, those that have passed away, and the survivors and all of their families that have gone through it specifically.
Helping everyone who has been impacted by it in any
absolutely.
way. Yeah,
I think everybody probably knows someone at least that is affected by breast cancer awareness. So it's just a time for us all to come together.
That is something important to remember, is that it's not just the breast cancer patient herself, it's their family, it's their friends. They also go through things during cancer treatment, during the support process and what breast cancer presents to the patient.
So you talked about self-screening and then mammograms. What is the process of diagnosing breast cancer?
That process can start usually one of two ways. The first way is a patient comes in with no symptoms, they just come in for a breast cancer screening. And then once it's read by a radiologist, the radiologist sees a change or an area that he wants to look at a little closer. And so we bring the patient back and do additional views with the mammogram machine and then usually an ultrasound. From there, if it looks suspicious to the radiologist, then it'll go to a biopsy. And from there, a definitive diagnosis from that tissue. The second way is if a patient comes to us with a symptom, a breast lump or nipple discharge or pain or skin changes. And we do those mammogram views there and with the additional views at that time as well. And then we go to an ultrasound and then the same process.
Follow-up question, do those symptoms always lead to a breast cancer diagnosis, or can they mean other things?
No, they can definitely mean other things, and they usually do. Especially a lump can be many different things. It can be a cyst or a fibroadenoma or, a lymph node that they can feel. So there are other explanations.
Thank you. That was off our normal question list, but it popped in my head, so I kind of was curious. So,
how does early screening impact treatment?
Early mammograms Early meaning age 40 is what is recommended by the ACR, which is the American College of Radiology. Starting at age 40, if you start a consistent screening mammogram process, which is yearly, consistency is the most beneficial thing because that can lead to early detection, which then leads to a more treatable cancer.
Yeah, I think like she said, just like any type of cancer, early screening is definitely important. It can definitely change how a patient's treated. So the earlier the screening and the earlier detected, the better for survival.
And because of that 40 age range that they put out there, I know many people who have been diagnosed with breast cancer at a younger age than 40. So it's really important to pay attention to your own body, to do your self-exams and make sure that you're aware of your breasts and make sure that you're just doing your own screenings so that you're aware of what your breasts feel like, so that if you feel anything different, that you would most likely start with a primary care provider, talk to them about it, and then they, if they feel it is necessary, can go on and suggest other testing be done.
What resources or tools do you think are helpful to people when they're first going through a diagnosis?
So initially, I know a lot of people worry about the cost of mammograms, and I'm sure you can talk about that a little bit. But there's a couple of resources out there that we have in our local area. Free mammograms in Idaho Falls. There's a website that's www.freemammograms.org/city/Idaho Falls. And then also coming up this month in October 11th, we have Break for the Cure at Teton Cancer Institute. So it's October 11th from 7 a.m. to 8 a.m. And you get goodie bags that also include a $45 mammogram for Mountain View. So we encourage a lot of people to come out and get those goodie bags. And light breakfast is included in them with the mammogram. And just use those to help the cost.
And those coupons are for women that do not have insurance or self-pay. And how that works is you'll still need an order from your doctor recommending a screening mammogram, but that will cover the hospital's charge for the mammogram. You'll have the radiologist fee on top of that, but covers the mammogram for you.
What different options or treatments are the next step after a diagnosis?
So after diagnosis, they will be sent to one of the medical oncologists in our area, whether that's at our facility or at Ermax Cancer Center. And then the providers are very good about going over, based on their type of cancer, what options there are for them. Some, if obviously detected early, they can do a mastectomy or a lumpectomy, depending on the type of their breast cancer. And they could be done then with just monitoring. Others require chemotherapy with mastectomy or lumpectomy. Radiation's also an option, and that can be with or without the chemotherapy. There's also immunotherapies. There's a lot of new medications that are given now for breast cancer, but also in general other cancers. So it's a broad variety. That's why we recommend, obviously, finding it early, but we can walk anybody through it. The oncologists are great at laying that out for what the plan will be for their treatments and what is best for their type of cancer, because there's so many. I think that's a misconception of breast cancer that we were going to talk about is there's more than 1, 2, or 3 different types of breast cancer. And so it greatly affects, depending on your type of cancer, what treatment you will receive. So, and there's also genetic testing that can be done that can help the oncologist do a specific treatment plan for that type of cancer.
There are a lot of people that I believe they think that breast cancer is breast cancer, and that's just not the case. There is several different types of breast cancer. You can be triple negative, you can be triple positive, you can have inflammatory breast cancer. There's a lot of different breast cancers that are out there, and they are treated differently based by the NCCN guidelines. So you'll go into your doctor, and they're going to follow those guidelines for your particular diagnosis. So, for instance, if I'm triple positive, they might recommend that I do some chemotherapy and some immunotherapy. How large my tumor is or isn't determines whether I have a full mastectomy or a lumpectomy. So it is individually based on what that particular man or woman comes forth with, what their diagnosis is, and how they will actually treat that.
So you mentioned genetic testing and how that is a tool that is used. How can family history, like the health family history, impact breast cancer?
Those who have a family history of breast cancer can have an increased risk of breast cancer. And it's important that they get genetic testing to help determine this and get an early screening. Many people are unaware that they may be at risk for breast cancer. You know, I've seen families that, or patients, I guess, that have come in over the years, and they'll say, yeah, my aunt had ovarian cancer, I had a sister die of breast cancer, and they'll list all these different family members who have either died or been diagnosed with cancer. When somebody says those things to me, as a nurse, I am thinking genetic testing because they have definitely got a family history, and that deserves to have some genetic testing. So it can be a simple sputum test you spit into a vial, or it can be a blood test, and they test that for different mutations in the blood. And it can tell you whether some of the mutations for breast cancer alone, it can tell you if you're BRCA1, BRCA2, CHEK2. There's other different mutations that you can have that make you more prone to having breast cancer. And that can be up to 80% chance of you having breast cancer. So some people will want to do prophylactic. You know, they may want to go and get a mastectomy. They just do not want to deal with that risk. And so they'll eliminate the risk by going in and getting a mastectomy. And then there are others. It's such a personal choice, but there's others that just decide that, you know what, I know this, but I don't want to take any action at this time. And there's no wrong way to do it.
And that's fine. It just also gives a better tool for them also to be aware and just better surveillance. Regular mammograms, maybe earlier mammograms, just better watching over their specific diagnosis.
And we do have programs that are in place for people who are BRCA1 or BRCA2 positive that, like Tamara said, they can come in and they can be regularly checked. They can alternate doing MRIs and ultrasounds. It just depends on what that particular doctor decides to do with the patient. So there are programs for these patients to help them get through that phase.
One thing we talked about earlier is how breast cancer is difficult not only for the person experiencing it, but for those who care about them and who are around them. So how can loved ones best support someone going through breast cancer treatment?
There are many ways that you can support loved ones. I think the biggest thing is to be a listening ear. Once you've been diagnosed with breast cancer, I think you feel maybe that your invincibility has been taken from you. You've all of a sudden got this life-changing diagnosis, and you really don't know what to do with it. You're confused, and you're asking yourself now, why me? Your loved ones are key in getting you through all stages of what breast cancer presents to you. And that, you say loved ones, that can be a friend, that can be siblings, it can be parents,
or
spouses, neighbors, yes. There's many people that can help you get through that. It's a traumatic, life-altering diagnosis. The patient may need to talk about how they are feeling mentally, emotionally, and physically, because breast cancer doesn't just affect the breast. It affects you mentally and it affects you physically. And then when you enter treatment, that again is challenged. Some individuals may not want to talk about it at all. Some people are just very quiet and want to keep it private. I would just say be conscious of their feelings and let them take the lead on the sharing, what they do and don't want to share. As far as loved ones go, they also go through a lot. Family members seeing things, standing beside you each day as you do struggle with it mentally. You go through the chemotherapy and you're fatigued. There's many things, many facets of that loved ones can really help to carry you from point A to point B in your diagnosis. So they're critical, I believe, in the recovery process and the whole journey that you are going through.
I think, too, maybe some simple things, just you get that urge to call that person or to text them. Make sure you follow up on that.
Absolutely.
Take them a treat. Just let them know that you're thinking of them and they're not alone.
And that treat might come at the most perfect time.
That's beautiful. Thank you, guys. It made me think of, I was pretty young, but my mom had a friend a family friend, and I think it was breast cancer. I'm pretty sure. But they kind of moved a little bit farther away, closer to better care. And I remember my mom and then another friend and we went to go see them, just say hi and also see how she was doing. And our other friend, she brought lotion, or they had lotion, and she just massaged her feet. And I just remember thinking, that is the sweetest, most kindest thing I've seen someone do for someone. And you could tell she was just like, and she was super gentle with her too. And it was just something like that. It was just thoughtful and kind. So, sorry, that's what you guys made me think
that's
of.
great.
Well,
That's a great example.
Yes, it is. Guaranteed that person, that meant a lot to her.
So you mentioned that it's not only like a physical effect that going through this has, but it's also mental and emotional. What resources or advice would you guys give for treating someone's mental health also?
So, Teton Cancer Institute, we have some support groups for individuals whose lives have been touched by cancer. So, Tuesdays at 5:30 p.m. at the Rexburg Teton Cancer Institute, there is a group meeting. Also, Wednesdays at 5:30 at the Idaho Falls Teton Cancer Institute at the Radiology Building. It's right next door to ours. There is a meeting for families or patients that are going through cancer to go and talk and get support just from others that are going through the same thing that they are. And then also we have a case manager that's really great about reaching out to patients who might need a little extra support or family members as well. And then individual therapy, obviously, like providers can do referrals for community resources if they're wanting someone else to speak to. There's Snake River Alliance. It's every third Tuesday of the month, 7 to 8:30 p.m. I believe that's at the Teton Medical Specialty Clinic on Woodruff. I was told that there's also wonderful things about Apple Physical Training Program for breast cancer survivors. And then the massage school offers discounted massages to cancer patients. And they're teaching a cancer-specific class with massage. So that's really nice to have locally.
That sounds like there's a lot of amazing resources.
Yeah, lots of resources. But I think it's just good to have others going through it to help you through it, to kind of help walk you through the stages too. Everybody's always in different stages. So I think just having someone that's going through it is a little bit more understanding as well.
And those programs are so needed. I mean, we talked about mental health with breast cancer patients, and to me, in that diagnosis, mental health is a big thing. I mean, the American Cancer Society said that nearly 1 in every 4 person diagnosed with breast cancer will experience depression. That's pretty huge when you think about that, 1 in 4. And they're not only being diagnosed with something, they may be going through body dysmorphia. Their body has changed because they've had a mastectomy. There are many things that could happen to somebody. There's things like breast cancer patients have had symptoms of addiction, anxiety, fatigue. They go through insomnia. Some of them have had memory loss. You can definitely have mood swings. I think you can ask a lot of breast cancer patients if they've ever had mood swings, and I can almost guarantee you their answer will be yes. And it brings on some PTSD. You might have trauma that has happened before. All of a sudden, you've got this new trauma, and it is bringing back things that have happened to you before. So these resources that Tamira is talking about are just vital, I think, for these patients.
This is changing tack a little bit, but what advice do you have for women who may feel anxious about getting a mammogram?
I don't think there's any woman that gets excited about that time of year that she needs to go in and get her mammogram. But honestly, the technology has increased so much that they really aren't the horror stories that you've heard from, 40 years ago. And they're fairly quick. We're very nice. It's a clean, nice facility. So I guess just jumping in and just doing that first mammogram will kind of ease your mind and help you feel more comfortable about continuing screenings.
And especially if you have something that's concerning you that you're getting it done for, the longer you wait, the worse that concern's going to be. So just like she said, getting in and getting it done, and just to ease your mind, if nothing else.
You mentioned that technology has changed and advanced. What are some of the advances in screening technology and then also treatment?
Well, I'll start with the screening part. A lot of people have heard about the 3D mammograms. That's tomosynthesis, which is basically Instead of a mammogram being one picture, it's a series of multiple low radiation pictures that are like stacked on top of each other. So it's kind of rebuilt as a 3D image so that the radiologist has much more information when they're looking at this. Breast density also becomes a factor. Some people just have dense breast tissue, and there's no way to change that. It's just how you are genetically made. If you do have higher breast density, screenings are very, very important, and especially these 3D mammograms are a huge benefit to women with dense breast tissue.
And as far as on the other side of it, obviously you mentioned genetic testing. That's been huge with breast cancer. And then also that's helped with new treatment options and modalities that we have. There's a few new drugs right now that are in clinical trial that I could find that just add more treatment options for different types of breast cancer like we talked about. And there are some diagnostic tools that are being studied right now for earlier detection for HER2 positive patients. And these are specific for imaging and testing for like if they in the past had like cancer maybe and now they have dormant cells that since after chemo that chemo does kill the majority of it, but there can always be dormant cancer cells. So there's new testing out there that they're researching to help maybe identify those dormant cells before they become active again. So there's lots of new innovation coming out through treatment and studies.
So earlier we talked a little bit about some of the misconceptions about breast cancer and mammograms. Are there any other misconceptions that you would like to talk about today?
I think our biggest one was just that it's just only found in women. It's also found in males. So it's very important that they're also doing their self-breast exams and just being aware that way as well, that they can also be diagnosed with breast cancer. It is not just females.
I think another misconception is that the radiation exposure is a bigger risk than the benefit to the mammogram, which is untrue. You'll actually get more radiation on an airplane, taking a flight across the United States than you would for one mammogram. And I feel like another one, really, when you get down to the statistics and everything, only 5 to 10% of breast cancers are genetic or hereditary. So I feel like a lot of patients feel like, I don't want the radiation, I don't have any family history, so I don't need mammograms. I can't feel anything, I do self-breast exams, but most of the time, in most cases, breast cancers are found before they're even felt.
Yeah,
So
I
feel
agree. That's very true. Yes. That's what the early detection is, especially that we keep pushing for with the mammograms.
It just shows how every part of it is important. Knowing your family history is important. Taking good care of yourself is important. Being aware of your body. Getting early screening. It all works together to make sure you're getting the best health care.
Kind of along that, something you said, Melissa, kind of made me think, are there any ways to if you are aware that you're at risk of breast cancer, are there any ways to work at preventing breast cancer?
Absolutely. Yes. Some ways to help prevent is obviously promoting a healthy lifestyle, eating a healthy diet, exercise or being more active, and maintaining a healthy weight. Also limiting your alcohol consumption and smoking can help lower your risk, and also lowering your stress levels, which I know is not easy for everybody. But those are some of the main ways that you can help lessen your risk of breast cancer.
What are some ways to become involved more? I guess we kind of talked about it a little bit earlier in the beginning about the goals of Breast Cancer Awareness Month, but
yeah. So obviously we talked about Break for the Cure October 11th at Teton Cancer Institute from 7 to 8 a.m. We also have Boo to Cancer at Teton Cancer Institute. It's a trick-or-treating on October 25th from 3 to 6. They actually set up a cute trick-or-treating area for kids to go around to trunks and just trick-or-treat, so that's one way. And then we have Run for the Cure coming up at Freeman Park on October 5th from 8 a.m. to 11 a.m. You can register online now, and I'll give you the website for that also. But locally, one of the biggest foundations that I would say that helps our patients the most is Shannon Wilker Foundation. He is so great to help our patients locally with funds that they may need, or I can't speak enough to Shane Wilker and how much he helps our patients locally. So if you're wanting to donate, I would highly recommend his foundation.
And he is a man that lost his wife to breast cancer. So he understands all facets
becoming involved too, like how would you suggest, I mean, we kind of already talked about friends and family supporting the person going through the breast cancer, but it popped in my head earlier when you said supporting the family members and loved ones of that person. How do we do that also? Because like the support system also needs support, right?
Absolutely, yes. I also just think checking in with them and see how they're doing, and if just offering to be there for them, to listen to them and any of their needs. I know a lot of times if things get crazy, even just a meal, if you could take them a meal for the night and just let them know that you're there, that helps leaps and bounds as well. And just being there for anything that they may need as well.
I think it's pretty simple. Like Tam said, if you have a friend that his spouse is going through breast cancer and he is 24/7 trying to help her, maybe reach out to that friend. Maybe he needs to go out to dinner with you for the night.
Yeah.
And just let him go out for the night. The kids might be going through things. Maybe take over a game for the kids to play together. Take their mind off of what their entire family is going through, because in essence, it is the entire family that goes through it. As a breast cancer survivor myself, I know my husband and my children went through a lot right alongside with me. They watched my pain, they watched my joys, they watched me triumph, they watched me fail. And so it is truly a family unit. And when I say family unit, it's your friends, your coworkers, everyone in your little world is so helpful in helping you get through a cancer diagnosis.
And I think, too, if they're obviously going through chemotherapy, too, friends can step in and help take them to their appointments. So maybe their spouse doesn't have to worry about missing work all the time to take them to these appointments, and just being another resource for them that way, too, for transportation and support. So they don't feel like it's always has to be them, and that they're the financial burden's getting worse from them missing work, too.
That's very true. I think we see that a lot. Is, the family members do struggle because dad is at her side, or maybe mom is at his side while he's going through it, and their finances struggle while they go through that process. So I agree with Tam that's pretty huge to step in and help them just by simply taking your friend to the appointment so that he can go to work.
A thought that comes to my mind is maybe grab the family members, the kids, get a little group and do Run for the Cure, get some fun hats or socks or leggings, and just go and have a fun time together and just try to get their minds off of the more negative, the more
mundane aspects of it. Absolutely. And you don't have to run. You can walk at these as well.
You can walk.
I walk. I do not run.
Is there any other information or message that you'd like to share about breast cancer or breast cancer awareness?
I think for me, mainly we want you to know you're not alone. There's many people out here to help you, walk you through it. And we become like your family. I mean, we're with you through all of it. So you just become a family member of ours. So just never feel like you're alone. Just remember there's always someone there to help you through it.
I think it's important to recognize that these patients, once they go through their treatment and they have their surgery and their radiation or whatever it might be, that it doesn't end there. Doesn't make them like all of a sudden they're cured, and they may be physically cured, but I watch women come in for their mammograms year after year, and just being in that area where they were diagnosed, they get, really anxious. And I don't know that there's a solution for that, but just to know that, again, that you're not alone. And there's people around you. If you need help, ask for it. I know there's a lot of people around these cancer patients that really want to help so bad they want to, but they're not sure what to do. So invite that.
That is huge, in my opinion, is to not forget those women that are in remission, because they still are fighting every single day. They still are going through things that they may need help with.
Well, and it's like Britnee said, too, like the fear of it coming back. I mean, that's always a fear. So it's always in the back of their mind that they're always worried about. So.
And it is so true. You walk into a mammogram, you have an ache or a pain or something like that, and all of a sudden your mind is thinking, oh my gosh, it's back. I need an ultrasound of this, or I need an MRI of this. And it's very real for them. It is very real. So it's a journey that
you can see that pain, you can see that worry, you can see that anxiety on their face, and it's heartbreaking for me.
Yes,
to watch that. But also the relief when they're given good news, that is also probably the best thing.
Yes. That is one thing I wanted to add. So, you get diagnosed with breast cancer, and that in and of itself is something so difficult to process in your mind. And then that's just the beginning. It's important, I think, though, to remember that there's so much out there to help you. So when you first get that diagnosis, I do remember thinking just utter despair. But then I learned along the way that there's so much out there that can help you get through that process. So many treatments. There's different things that you may go through. I mean, you're going to go through initial treatment of chemotherapy, maybe radiation. Those are all going to be little hurdles that you've got to go through, and to not lose hope. It's a hard thing to go through, but don't lose hope. There's so many things that you can do to help yourself get through that. The recovery process, you think that, okay, all right, I'm in remission. Yay, it's all over. That's not the case for some of these women. Some of these women take a pill every single day to keep their hormones at bay. Maybe their cancer food, the food to their cancer was hormones. So they take a pill every single day to ensure that those hormones are not present in their body, so that the food to the cancer is not present in their body. And now that medication comes along with a lot of side effects as well, like bone pain, memory loss, emotions.
And fatigue. Fatigue is one of the biggest
huge,
things.
Very huge. So but there is so much hope in it. There's many different things that you can do to combat those side effects. But if you are feeling just overwhelmed, there are people that you can reach out to help you get through those days that you are feeling despair and like, I cannot take another one of these pills again.
Well, thank you so much, Tamira, Casey, and Britnee, for coming in and talking with us today.
Thank you for having us, guys.
We are super grateful for your guys' insight and for what you do to help people.
Everybody come out for Break for the Cure.
Yes. Support. Yes. That is a way we can help.
Bring your whole family.
Thank you to Mountain View Hospital for sponsoring this episode. If you enjoyed today's episode, please remember to share, subscribe, and rate the Riverbend Awareness Project.
If you'd like to send us an email, you can reach us at podcast@riverbendmediagroup.com. Thanks for listening, and join us next time on the Riverbend Awareness Project.